Number 7, medication reconciliation. The provider who receives a patient from another setting of care or provider gets that medication reconciliation, and they can either do it by paper or they can do it electronically. So that's the key here, is whether people can do that via the paper that they're going to have in their hands, or they're going to be able to do that through the CCR CCD import that they're getting from those other EHRs. So this is going to be the changes that were created in 9.5. So a new medication reconciliation tool is going to be available on the current medication list. There's going to be a way to document both electronic and paper MedRecs. And the new encounter types are going to be inbound for the ones that you're receiving and outbound for the ones that you're sending out. Here's the document MedRec from paper. This is kind of the workflow that's going to be generated from that. So this is what 9.5, I promised you guys this is what it was going to look like. So it has this allergies reviewed section. It used to be down here for 9.4. It's getting popped up here above the allergies or intolerances. And the medications reconciliation spot is actually going to be taking its place. So what you're going to do when you're going to do a MedRec for paper is you're going to click on the MedRec button here. You're going to say Document MedRec, and what it will do is it'll give you this clinical encounter screen. On this clinical encounter screen, this is where you're going to be able to determine if that transfer of care is internal or external. So if you're getting that or if it's outbound. And then you're going to be able to put in a little bit of information on that transfer of care. So you're going to be able to put in if it was an office visit, what the date was, what the time was, who the provider was. You're going to want to check the transfer of care. So if it was inbound, you check inbound, outbound, of course. And then the big part is you want to make sure that the relevant for medication reconciliation is turned on so that that counts in your system. If we're doing a CCR or a CCD, when you're doing that, when you import that CCR CCD, dang it, this is the screen you're going to get. And if you look here, we got medications, and you have all of these check boxes here. So if you want to pull in those medications, you leave them checked. If you didn't want to pull in a medication, you just uncheck it, and it won't pull that onto your medication list. There's a Show Med List button down here. And there's also a Document Medication Reconciliation checkbox right there. If you check that medication reconciliation, it automatically puts in that MedRec option in your system. If you hit the Show Med List option, this is what it's going to show you. It shows you on the right side what you currently have in Practice Partner, Medisoft Clinical, Lytec MD. And then on the left side, it shows you what you're bringing into your system. So what you might want to do is you might want to uncheck some because you don't want to have a little bit of a change or something like that on your med list. And then the transfer of care would automatically be documented based off of how you were putting that into your system. Also, I want to mention there's going to be a new dot code in the system available for this one. So if you're going to be doing a MedRec via paper through the progress note, what you can do is there's going to be a .mrc:, you're going to put in who the operator that's doing that. You're going to put the date, the time, and then the provider ID, and that will document that you did a medication reconciliation via paper through the progress note. So you can have that in a quick text or whichever, and you can just quickly document that through the progress note. So here is how you can get qualify for this. It's going to be your providers that do more than 50% of the transitions of care with this medication reconciliation turned on. So that's how you're going to get those. So 50% of all transitions of care with a med list. So it doesn't matter if it's inbound, outbound, as long as 50% of those you're doing those through a MedRec, you'll be fine. So here's the denominator. It's just the encounter provider, the dates, and then the encounter is marked for an inbound clinical encounter. So I misspoke. It is only for inbound clinical encounters. I apologize. And the number of clinical encounters in the denominator set that have a medication reconciliation. So it's only inbound encounters that you're getting and the ones that you're marking as MedRec completed.